Japanese geriatric medicine has a phrase that does not translate cleanly into English. The closest version is, the muscles are the pharmacy. Not poetic, clinical. The argument that strong legs in old age prevent more conditions that require medication than almost any drug designed to treat those conditions afterward. The average American over 65 takes between 4 and 5 prescription medications simultaneously. Polypharmacy, managing multiple drugs at once, is now the statistical norm for older adults in the United States. In Japan, that number is meaningfully lower. The difference is not genetics. It is not entirely diet. Japanese geriatric physicians point to something they call functional reserve, the body's stored capacity to absorb strain and keep functioning under pressure. And the primary driver of functional reserve is muscle. Think about what the other trajectory looks like. Not a single health crisis, just a slow accumulation. The doctor visit where a second prescription gets added to the first, then a third to manage a side effect of the second. The morning pill organizer that gets heavier each year. The point where you stop asking if you can get off a medication and start asking which ones you absolutely cannot stop. Japanese geriatric medicine has spent decades showing that trajectory is not inevitable, and that the window to change it is earlier than most people think, and simpler. This is not a video that will tell you to stop taking your medication. What it will show you is how Japanese seniors approach the years before that conversation becomes necessary. The daily physical habits that keep the body functional long enough that many of those conversations never happen. Japan has the oldest population of any country on Earth, and yet its rates of age-related disability, the kind that ends independence, are among the lowest in the developed world. The answers that keep emerging are not dramatic. They are not expensive. They are habits. Habits that most Japanese seniors do not think of as health practices at all. The 6 habits in this video target the legs, the muscle groups and movement patterns that determine whether an older body stays upright, stays mobile, and stays out of the doctor's office. None require equipment, none require a gym. Several happen during activities you are already doing every day. The last one on this list was the subject of a study that assessed thousands of adults on a single physical task and tracked their survival for years afterward. I will give you the full details when we reach it. One question before we begin. Have you noticed any changes in your legs over the past few years? Stiffness in the morning? Less confidence on stairs? Anything like that? Leave it in the comments. I read all of them. We begin at number 6. Number 6, Sankyo, the deep squat rest. Walk through a traditional Japanese market, a rural garden, or a train platform on a slow afternoon, and you will see something unexpected. Older adults, not young athletes, not people warming up for exercise, simply squatting, fully. Heels flat on the ground, knees wide, hips dropped well below knee level. Resting, waiting, having a conversation. It is called Sankyo, and for most of Japanese history, it was simply the default resting posture, the way sitting in a chair is the default in the West. The deep squat demands full mobility from the ankles, knees, and hips at the same time, keeping the tendons around those joints supple and maintaining the range of motion that most Western adults begin losing in their 40s from decades of chair sitting. And when that range of motion goes, the consequences travel upward through the body. Rising from the floor becomes impossible, and walking stability drops because the knees and lower back are now compensating for what the hips can no longer do. And that compensation is where chronic pain is born, long before anyone connects it to a flexibility problem that started years earlier. You do not need to squat for 20 minutes. Stand in front of a sturdy chair or door frame for support. Lower yourself into as deep a squat as is comfortable, holding the support lightly. Hold for 20 to 30 seconds. Work towards 60 seconds over the first month. The ankles are usually the limiting factor. If your heels lift off the ground, that is the tightness to address first. A rolled towel placed under the heels allows the position while that mobility develops. Sankyo maintains the foundation, the joint range and tendon health that everything else on this list depends on. What it does not train is the strength to move through that range under load. That is what number 5 addresses. Number 5, Kaiden, deliberate stair preference. The elevator is not neutral. Every time an older adult chooses a lift over a staircase, They are making a small withdrawal from a finite account. The thigh muscles, the gluteal muscles, the calves, these do not maintain themselves. They require load. They require the repeated demand of lifting the body against gravity. And without that demand, they reduce. Not dramatically, not all at once, just a fraction here, a percentage point there, until one day the account is low enough that the body cannot afford an unexpected demand on it. A stumble, an illness, a week in bed, without falling into a deficit it cannot climb back out of. Japanese seniors have long treated stair climbing as a deliberate habit rather than an inconvenience to avoid. Stairs are not a burden. They are a daily deposit. Choose stairs whenever there is a choice. If staircases are not part of your daily environment, create the equivalent. Step-ups onto a low, stable surface. A bottom stair, a sturdy step stool, 2 to 3 sets of 10 repetitions per leg daily. And when descending, slow down deliberately. The downward phase, lowering the body with control rather than letting gravity do the work, works the thigh differently than climbing does, and that controlled lowering is where much of the strengthening benefit lives. Number 4, Shomen Aruki, heel-to-toe walking discipline. Western medicine has, for decades, given older adults one consistent piece of walking advice: walk more. The guidance is correct as far as it goes, but it says nothing about how, and how matters enormously. Most adults who have spent years in cushioned, elevated heel shoes walk with a gait that has subtly shifted from what the human foot was designed to do. The heel strikes hard. The arch collapses slightly. The toes do very little propulsive work. Over time, the small muscles that control the arch and the toes weaken from disuse. When those muscles go, the stability that should begin at the foot is lost before it can travel upward into the ankle, knee, and hip. Japanese walking culture has preserved a gait pattern that Western rehabilitation physicians now study and deliberately prescribe. A heel-to-toe roll with each step, the foot peeling off the ground from heel to ball to toe. The toes push, the arch engages. The foot becomes an active contributor to stability rather than a passive platform. Practice this consciously for 5 minutes of whatever walk you are already taking each day. Slow down slightly. Feel the heel contact first, then the weight roll forward through the arch, then the toes push off. It will feel unfamiliar at first. That unfamiliarity is underused muscle being asked to work. Within 2 to 3 weeks, it begins to feel natural, and the ankle stability that follows is noticeable. Number 3, Tanden Kokyu, breathing squat. Heel-to-toe walking rebuilds stability from the ground up. Number 3 works from the opposite direction, from the trunk downward, through the pressure system that keeps the spine stable while the legs move beneath it. Japanese movement traditions have long centered on the tanden, a point roughly 2 inches below the navel, described as the body's center of gravity and the origin of stable movement. When you breathe deeply into the belly and brace, you build internal pressure that supports the lower spine like a natural belt. When that system is weak, the legs cannot transfer their strength upward efficiently. The hips lose their anchor, and the lower back quietly absorbs forces it was never built to handle on its own. Japanese rehabilitation clinicians have observed that patients who coordinate breathing with squatting movements recover leg strength faster and hold it longer than those who do the movement without the breath. The breath is not secondary, it is half the movement. Stand with your feet shoulder-width apart, hands resting lightly on your thighs. Breathe in slowly through the nose, feeling the belly expand rather than the chest rise. As you exhale slowly through pursed lips, begin to lower into a partial squat, no deeper than chair height. Hold the lowered position for the full exhale. Inhale as you rise. That is 1 repetition, 8 to 10 once daily. The depth of the squat is not the point. That coordination is. Number 2, Hadashi, barefoot indoor walking. The foot contains 26 bones, 33 joints, and over 100 muscles and tendons. It also contains thousands of sensory nerve endings that continuously tell the brain about ground texture, pressure, and the angle of the body above it. This is one of the brain's primary tools for staying balanced, and it works best in direct contact with the ground. A study published in Gerontology followed older adults who adopted daily barefoot walking on indoor surfaces for 12 weeks, against a control group who continued wearing standard footwear indoors. The barefoot group showed meaningful improvements in balance scores and a reduction in sway, the unconscious micro-adjustment the body makes to stay upright. The improvement came not from muscle strengthening, but from enhanced sensory feedback. The foot was simply receiving more accurate information, and the brain was responding with better control. Japanese homes have preserved this through cultural practice. Shoes come off at the door. Movement happens in socks or bare feet on tatami, wood, and tile. Surfaces that feed the very sensory system. Thick soles block entirely. Remove your shoes when you arrive home and walk barefoot or in thin socks on your indoor surfaces. 15 to 20 minutes daily to begin. If the floors are cold, thin indoor shoes without cushioning preserve more sensory contact than thick-soled slippers. It is a small change. Over time, it recalibrates the system that keeps you steady without thinking about it. Number 1, Okiagari, rising from the floor. Earlier, I mentioned a study that tracked thousands of adults' survival for years after a single physical test. The study did not originate in Japan. What Japan did was practice this movement for centuries before anyone thought to measure it. Traditional Japanese domestic life happens close to the ground. Meals at low tables, sleep on floor-level futons, socializing on tatami. The average Japanese adult rises from the floor and lowers back down dozens of times each day, not as exercise, as ordinary life. That repeated practice quietly maintains a physical capacity that Western adults typically begin losing in their 50s, without noticing it is gone. The study was published in the European Journal of Preventive Cardiology. Researchers assessed more than 2,000 adults between the ages of 51 and 80 using what they called the sitting rising test. The task: lower yourself to the floor and rise again without using your hands, knees, or forearms for support. Every point of support used took 1 point off a total score of 10. Researchers then tracked participants for an average of 6 years. Those who scored in the lowest range were more than 5 times as likely to die from any cause during that period compared to those in the highest range. Each point lost was associated with a 21% increase in mortality risk. That finding needs a careful explanation. The researchers were not claiming that the inability to rise from the floor causes death. They were observing what it reveals. Getting up from the floor without support requires strength, mobility, and balance all working together. When the score is high, those systems are communicating. When it is low, enough of them have quietly deteriorated that the body can no longer coordinate them. It is not the test that matters. It is what the test is reading underneath. Once each day, lower yourself to the floor and rise again. Use a hand on the way down if you need to. Safety first, always. The goal over weeks and months is to need that support less. Lower to seated, then to one side, then back to seated, then to standing. Move slowly and with control. If the floor feels too far, begin with a very low chair or a firm cushion and work from there. Progress is measured not in speed, but in how much of the movement you can perform without needing anything to brace against. This is the only habit on this list that does not fit into sets and repetitions. Once a day, down and back up. That is all it asks. That is all 6. The body responds to what you ask of it. Ask consistently, and the trajectory changes, not quickly, but reliably. These 6 habits are what Japanese seniors have been asking of their bodies for generations. The research is now catching up to what they already knew. Dosage and progression details for each habit are in the description below. Leave a comment and tell me which of these 6 surprised you most, or which one you already do without having thought of it as a health habit. And if someone in your life is at a point where these habits still have time to make a real difference, share this with them. The best time to build this kind of reserve is before you need it.